Hello class, this is Amber. We're going to discuss today talking to a patient at discharge time about their instructions and giving them the information they need to go home with. Forewarning you, you're probably going to hear Mickey Mouse in the background. I have to keep my daughter occupied somehow. So here we go. My patient that we will be discussing and talking with today is named Mr. Nevada Joe. He is a 70-year-old male. He's 6'3", 245 pounds, from the Navajo descent, and he is a resident of Las Vegas. Mr. Joe was initially found on Las Vegas Boulevard. He was unresponsive. He had the smell of alcohol, cigarettes, and vomit. Mr. Doe was resuscitated at the scene. He was intubated. At this point, he was transported to the nearest hospital, and we will skip all the details of what happened between then and discharge. The most important thing to know is he does have some family, but he is a homeless resident of Las Vegas. So here we are. We're going to discuss the patient today about what needs to be discussed with the patient. The alcoholism, his heavy drinking, discuss his alcoholism ideas to get him to quit. Same thing with smoking, educate him and managing his COPD. That he stops. We are also going to discuss with him the fact that he's homeless and how we can get him on a better path. A 3-pack a day for 50 years, and it's very important to help him understand the necessity to stop smoking, to give him the diagnosis of COPD and how to help manage it, along with shelter. Now, 3 of these things are difficult considering his living situation. Now, our objectives for teaching the patient will be, after discussing the education, that we want the patient to be able to immediately identify strategies to reduce their alcohol consumption, ways to practice a smoking cessation technique, and to be able to differentiate and know the different shelters that are available to them. So now, walking into the room, you want to walk in there, introduce yourself, explain to the patient why you're there. Your purpose is to build a relationship with the patient. Ask about them. Do they recognize their problems and conditions? What are his ability levels? Does he understand what you're saying? Does he want to get better? This is where you want to make the patient feel comfortable in speaking with you and opening up with you. This may look familiar to you. It showed up in a previous presentation of mine, and it was also in the book. But if Mr. Doe is kind of hesitant towards his, maybe let's say his drinking problem, this would be a good little tool to use to bring it to light that, hey, maybe there is a problem. It's just a 4-question test, and it's a simple way to put things in perspective for the patient. So now we've told Mr. Doe, and not in those terms that you're an alcoholic, but, okay, you drink a little too much. So now we need to give him a reason why it's important to stop drinking. At this point, Mr. Doe has an enlarged liver.
Mom, I stopped drinking too.
You stopped drinking too?
Yeah.
Mr. Doe has an enlarged liver from consuming too much alcohol. So what is this going to lead to? Well, alcohol liver disease, cirrhosis. Why are these important? Because they lead to death, and this is what we want to avoid. He still is only 70 years old, and if you can stop drinking, there's even a statistic here that says 90% of people that are diagnosed with cirrhosis can add 5 years to their life by just halting the drinking now. So this needs to be explained to Mr. Doe and why it's important to stop drinking at this time. We also have to discuss some treatment options. There's pharmacological, which is to help with the withdrawals, not so much the stop drinking, but withdrawal symptoms. Psychotherapy, which is a behavior modification, which helps coping with coping skills. Peer support is like AA. A 28-day inpatient program. There's an intensive outpatient program. And the sensible interventions are, okay, you can't quit cold turkey, but hey, let's cut it in half. Let's slowly reduce the amount. Then we move on to why he needs to quit smoking. And at 3 packs a year for 50 years, this might be a very difficult one. All of us being respiratory therapists, though, I don't think I need to explain the whys. I think this comes naturally to us to discuss why it's necessary to quit smoking. But I did post these. I think these are awesome to use for patient education because it kind of breaks it down to simplicity, really, to show the patient, look, here's 3 options that are non-prescription to help you stop smoking. You're putting the ball in his court. You're saying, Mr. Doe, which one of these would work best for you? Patch, gum, lozenge, and it tells you what it does. You're giving him that power to make the option for himself. Then here's prescriptions. Here's what they do. What would you like best? Again, patient is making their own decisions. They're intervening with their own health. And then there's also some online counselors, free websites that this gives you. So I really liked the use of this. It kept it simple. It gives the patients the power to make their own decisions. As far as discussing the wheres and the whys as therapists, I don't think I need to go over that. I think we're all pretty good with that. And this is also some techniques of how to get past the cravings and the urges. Some people say, oh, what do I do with my hands? Well, here's some things, chew sugarless gum, drink water, deep breaths, toothpicks, exercise, things like that. Just anything to get past that 2-3 minute craving you get from not smoking. More fun stuff to discuss with Mr. Joe. He has COPD. We need to explain to him what this is. Keep it simple. COPD is a lung disease that makes it hard to breathe. It's caused by damage to the lungs over the years of smoking. We need to let Mr. Doe that this does get worse over time. And though you can't, it's very similar to what's happening with your liver. There's damage. Though it can't be undone, you can take steps from preventing more damage and to help you feel better. Since in the back of our mind we know that Mr. Doe is not really returning to a home, a lot of this information and the paperwork that we're giving him is probably going to be shoved in a backpack, thrown in a trash. In our perfect world, and for this patient, he's going to be the perfect patient, and he's going to comply with everything we tell him, and he's going to want to make a change. But in the real world, that's not going to always be the case. This is a good little one-page paper of, okay, you have COPD. Some days are going to be good, some days are not. But, here's how to, take care of yourself, when to go to the hospital, when to call your doctor, when to drink more fluids, when you're doing great, things like that. It's just a good little chart. I think this is very helpful to give a patient. Now, it's because of the COPD. Again, simple. Very simple, easy to read. Because of the idea, again, that doesn't take much thought on this one. Is homeless, does not have insurance. Since in the back of our mind we know that. Things of that sort. Mr. Doe, we're giving him an MDI. Not really returning to a home. We're going to instruct him a lot of this information and the paperwork that we're giving him. He doesn't seem to be a frequent flyer. It's probably to give him shoved in a backpack, a prescription to use on a day-to-day basis. In our perfect world, and for this patient, he's going to be the perfect patient. Not 100% sure he'll with everything we tell him and things like that. He's going to want to make a change. When you're having a tough day, when you're having a hard time breathing, that's not going to always be in your pocket. That's when you need to use this. This is a good little one-page paper of, okay, you have COPD, things like that. Some days are going to be good, some days are not. We're going to explain to him. You take the cap off and you shake the inhaler. Here's how to prime it. Take care of yourself. We'll demonstrate how that works. When to go to the hospital. We ask him to breathe all the way out. When the inhaler does not go on your lips, it goes when you're doing great. Things like that. It's just a good little chart away from your lips. Helpful to give a patient, and you start to slowly breathe in. Very simple. You actuate the inhaler. Doesn't take much thought on this. You'll be showing him how to do this. You'll push down on it. Sense in the back of our mind, breathe in very slowly. As deep as you can, and hold it as long as you can. Not really returning to a home. I will explain to him that a lot of this information and the paperwork that we're giving him, and I'm going to have Mr. Jones show me how to do this. Probably show me ashamed and embarrassed me that he understands what I'm telling him, and that he knows. In our perfect world, and for this patient, he's going to be the perfect patient, suggestive, and offer our knowledge. He's going to want to make a change. But in the real world, that's not going to always be the case. This is a good little one-page paper of, okay, you have COPD. Some days are going to be good, some days are not. This is a list of different shelters that are available. This actually comes off of sites for Las Vegas. How to, take care of yourself. Probably as caregivers, when to go to the hospital, going to see when to call your doctor, when to drink more fluids, more when you're doing great, things like that. Places. It's just a good little chart. So we should be aware of what's out there. That way we can direct. Again, simple. These very simple, easy to read. To stay. Doesn't take much thought on and what fits them the best. Since in the back of our mind, important for you to know. So, again, a list of more types of shelters that are available to the homeless. A lot of this information, Mr. Doe's paperwork that we're giving, I would probably recommend him to go to a drug and alcohol rehab program. They are, shelters that they do breathalyzer tests. In our perfect world, and for this patient, he's going to be the perfect patient, and he's going to comply with everything we tell him, and a cot. He's going to want to make a change. But this is intended. But in the real world, specifically for the alcohol that's not going to always be the case. This is a good little one-page paper. There are some state assistance you have to COPD. They sometimes have some days are going to be good, some days are not. To pay for this, things like that. There's also step-up how to things where take care of yourself, the supportive housing, when to go to the hospital, shared housing, when to call your doctor, when to drink more fluids, which are low when you're doing great, things like that. It's people all in the same situation, sharing one room or one. Again, home. Very simple. These are just little visuals. But again, good information, which is after you're going to pass on a photo from. Since in the back of our mind, we know that. Again, a list of more types of shelters that are available to the homeless. And a lot of this information, I would probably recommend that we're giving him go to a drug and alcohol rehab program. They are probably, shelters that they do breathalyzer tests. They do provide you. In our perfect world, and for this is a list of local shelters. They're good to know, but if anything, remember the 211 you want to make. You can get referral services specifically in the real world to provide your patient. That's not going to always be the case. And this is a good little one-page paper of, okay, you have COPD. Have you work. Some days are going to be good, some days are not, things like that. But there's also, step-up type things where how to the supportive housing of yourself, and you can go to shared housing, to room and board housing. When to drink that concludes my presentation. When you're doing people all in the same situation, sharing more for the caregivers. Is that video that I suggest you watch. Again, simple. But again, simple. That's kind of information for you to know as the caregiver doesn't take much thought on their situation. And sent to the back of our mind. Again, a list of that you watched it. Thank you all very much that are available to the homeless returning to a home. In Mr. Doe's situation, a lot of this information and the paperwork that we're giving him, rehab program, they are shelters that they do breathalyzer backpack thrown in a trash. They do provide you with. In our perfect world, and for this patient, he's going to be the perfect patient. He's going to comply with everything we tell him. But this is intended. He's going to want to make specifically for the alcohol dependence. But in the real world, that's not going to always be the case. There are some state assistance. This is a good little one-page paper of work. You have COPD. Obviously, some days are for this, things like that. Not.